Okay, Assalamualaikum wabarakatuh, and a very good afternoon to all the candidates that will sit for the part one master exam. Okay, my name is I'm Dr. Muhammad Yusof. I'm a generic surgeon. Now I'm in the part of the team. Okay, so today we will discuss regarding a topic of principle of energy device in surgery. Okay, so I give 10 minutes. Okay, this is a common question lah. Common question that may be asked during OSCE exam. Okay, semua dapat everyone can read the question.
Yes, we can read the question.
Okay, supposedly in real OSCE is 20 minutes lah. So tapi because 20 minutes too long, so we try to do in 10 minutes. Okay, so boleh start sekarang. Okay, everyone, you guys have 3 more minutes, 3 more minutes. Okay, 1 more minute. Okay, everyone can put down your pen, pencil. Okay, so we will discuss. The answer at the end of the presentation. Okay, how's my voice? Is it clear? Everyone can hear my voice?
We can hear you, Mr. Yusof.
Clear, Okay. So soalan macam mana? Susah ke senang? Susah, senang.
Susah juga lah.
As expected, tapi susah sikit.
Okay. Okay, so okay. Mana saya nak ke belakang? Okay, so surgical energy device. Okay, so what is surgical energy device? So it is a handheld device, okay, which use electric current either to cut or control the breathing. Okay, so for this presentation, okay, we will try to cover 2 types of energy device. Okay, the first one is electrosurgery, and the second one is ultrasonic energy device. Okay, for electrosurgery is is the device that when the electric circuit and current pass through the tissue to produce the effect. So it means that from the generator to the handheld energy device, and then the current will go to the patient, and then will return back to the energy device. Okay, so you have two types, either monopolar diathermy or bipolar diathermy. But for ultrasonic energy device, it produce ultrasonic generated friction, and then the friction will produce the heat. So for this, for current market, we have three types so far: harmonic, couple, thunderbit, and also Gigashow. Okay, so we go first to the diathermy, which is the electrosurgery energy device. Okay, so what is the principle of the diathermy? So diathermy it is a high frequency alternating current, okay, which pass through body tissue, and then the heat will produce from the energy from the electric current. The heat can be as hot as 1000 degrees Celsius. So the current frequency is ranged between 200 kilohertz to 10 megahertz. Okay, so as you can see from the picture, within this range, so it will not affect either your muscle contractility or your nerve stimulation. So for energy device, we have two types, either monopolar diathermy or bipolar. Okay, so we go to the first types, which is the monopolar diathermy. Okay, so if you can see from the picture, okay, so the current is a pass from the generator to the tip of the instrument, then to the tissue, and then it go back to the generator. So for this energy device unit, there is four components, which is the generator, the one that produce the electric current, and then the active electrode, which is the handheld device at your hand, the patient, and also the patient return electrode, which is the return electrode pad. Okay, then for the monopolar diathermy, we must understand the concept of a waveform. So you have either constant waveform, intermittent waveform, or blend waveform or blend current. So for constant waveform, okay, which means that the waveform is constant. There is no interruption. So it will produce heat very rapid. So the purpose is to vaporize or to cut the tissue. Okay, but for intermittent waveform, if you see at the right corner end of the picture, so the moderator will modify the waveform, okay, so that the duty cycle or the on time is reduced. So you have a period of interruption without any waveform. So it's a produce less heat. So the purpose is to produce coagulation. So and in between we have a blend current, okay, this is a modification. Okay, the higher from 1 to 3, then it will be lesser the waveform. Okay, so the 1 is more to vaporize the tissue, and the 3 is more to control the hemostasis. So the tissue effect of the monopolar diatom. So you can achieve three tissue effect. So either for cutting, for fulguration, or for desiccation. Okay, so the purpose of cutting is for you to cut the tissue during the surgery. So how it works? So from the it, from the tip of the electrode, so it will produce the electric spark. So electric spark have a very high intense energy, and then concentrated electric spark, so it will cut through the tissue. Okay, for fulguration, we use uh, the the laser duty cycle, which is the 6%. Then it will produce heat to the white area, and then the purpose is more for coagulation. Okay. For desiccation, so the electrode is at the direct contact of the tissue, so it produces less heat and no fatigue. So you for desiccation, so you must touch the tissue. So the purpose is more for the coagulation. Okay. And then the circuit pathway. Okay, so before 1968, we used the grounded electrosurgical system. Okay, which is the electric current which being produced by the generator, and then it will go to the active electrode to the patient, and then we have a return electrode and then go to the ground. Okay, this is because theoretically the electric current it will go the electric current it will go to the less resistant pathway. Okay, so the alternative part ground is to prevent the electric from go to any alternate device. Examples, your ECG pad, because if it go to the ECG pad, then it can cause a burn over that pad. Okay, but then by time the technology evolved in 1968, so we have the isolated electrosurgical system. Okay, rather than we need alternative pathway or through the patient, the electric current it will go back to the generator. Okay, but through the written electrode pad. Okay, but if the electrode pad is broken, then you will have burn because the current will concentrate to the patient body, then go to the ground. Okay, you must know regarding the return electrode pad. Okay, for return electrode pad. Okay, the purpose of return electrode pad, it is act as an entrance pathway. It will collect the electric current, and then from the patient to the return electrode pad, and then it will go back to the generator. So it must have a large surface, because if it have a small surface, the electric current will be concentrated, and then it will cause burn to the skin. And it should place close to the operative site if possible, and the ideal location. It must be well vascularized muscle mass, and try to avoid the location is vascular insufficiency, because if it's caused small vessel, especially can cause capillary burn, so it will worsen the blood supply to that area of the tissue, and for try to avoid irregular body contour or at the body prominence. Okay, so that we can apply the return electrode pad properly. Okay, now we go to the bipolar diatom. Okay, ni so far okay. Saya punya suara okay. Slide semua nampak pun okay.
Okay, Mr. Yusof.
Okay, so for bipolar diatomy, okay, rather than monopolar diatomy, okay, which the electric current flow from the generator to the to the handheld device, to the patient, to the electrode return pack, then go back to the generator. This bipolar diatomy, it doesn't go to the patient. It just pass from one jaw of the handheld device to the tissue between the handheld device, then to the opposite jaw, and then back to the generator. So for bipolar diatomy have advantage rather than monopolar diatomy, because it does not require return electrode pad, so patient have less complication if there is electrode pad dysfunction or problem. And also it can be used on pedicle or small tissue. Example, you can use the bipolar diatomy for circumcision. Try to avoid, not to try to avoid, okay, don't use the monopolar diatomy during circumcision. And also the bipolar diatomy is very safe in if the patient have a pacemaker. Okay, so the possible diatomy hazard. Okay, you can have a burn, either skin or tissue burn, if return electrode pack is not applied properly. And also current division to other metal material. Example, if a patient wear gelang ke rantai, then the electric current can travel to the gelang or rantai, and then can cause, it can cause also fire if especially if we use the alcohol skin preparation. So this is one of the reason. If you use alcohol to prep the patient, then you have to wait for the alcohol to dry before you start your cutting using the diatomy. And also the diatomy can also produce smoke, which may obstruct view, especially during laparoscopic surgery. Okay, then we go to ultrasonic energy device. Okay, so rather than electrode surgery energy device, which is a diatomy, which use electric, that will pass through the handheld device and then to the patient, and then go back to the generator. The ultrasonic use compression and friction. Okay, so from compression and friction, from the friction especially, it will produce heat. Then from the heat, then it will cause it can cause a coagulation or also a cutting. So the ultrasonic, it will vibrate the instrument blade up to 555,000 hertz per second. And then by vibration, the amino acids will unwind and also reshape, and hydrogen bonds will break, and then thus it causes coagulation. So it safely coagulate and also transact large vessel. Okay, the diameter of the vessels differ. It depends on the types of the device. Okay, the advantage of the ultrasonic energy device rather than electrosensitive energy device. First is excellent in hemostasis control. Ultrasonic energy device, it can control the hemostasis better than the titanium. And also minimal lateral tissue damage. And so it produce low smoke, and also patient have no risk of electric current passage to the patient. Okay, this is depends where you work in your hospital. Some good hospital, some center have all these three, some only have one, some yang tak ada pun ada. So the common types. So the first you have the first type, you have the Thunderbits. So Thunderbits is produced by the Olympus. So it is a integrated device, which means that in the device it has the ultrasonic and also bipolar energy, and it can secure seal blood vessel up to 7 millimeters. Then you have the Ligashua. Ligashua is from Covidien. It can secure blood vessel up to 7 millimeters. Sorry, for Ethicon, Harmonic. Harmonic is from Ethicon. Ethicon, it can seal blood vessel up to the Ethicon is not 7 millimeters. Ethicon is up to 5 millimeters. Okay, so this is the difference from the Thunderbit, the Shure, and Harmonic scalpel. So if you can see the first one, the Thunderbit, okay, in terms of visibility, operating time, burst pressure, and also thermostat, the Thunderbit is the best compared to the other. Okay, so that's all I think regarding energy device. I think for we can discuss the first other question that I put before the presentation. Okay. Baru nak panggil soalan-soalan. Okay. So if you see the question for this for the question, okay, there is multiple components that you must consider. Okay, this patient, okay, first is a old age patient with heart disease. Okay. Second, the type of the surgery. It is a elective open surgery. It is an elective open surgery. And then you must consider the possible energy device that you may use during the surgery. Because this is an elective surgery, so you have time to prepare and optimize the patient before the surgery. Okay, so pre-operatively, so this patient you must manage as a multidisciplinary team. So involve you, the NS, the cardiologist, and so the staff. And also you have to, if the pacemaker or the patient previously fall out from different hospital, so you have to call that center to get the information. Okay, then you must have the information regarding the heart, the patient functional status, the patient echo, the cardiac risk assessment, how high is the risk of mortality or morbidity, so that you can explain to the patient also remembers the medication the patient's on, and also degree of pacemaker dependency, either the patient required the pacemaker most of the time, and also the patient may need a bridging therapy if indicated. Then information regarding the pacemaker, you must know the device, manufacturer, the model, the serial number, date, the pacemaker implant. Okay. So when is the due date that the pacemaker should be replaced? And then any advice during surgery by the cardiologist, especially regarding the pacemaker. Or some pacemaker you need to program it to be compatible during the surgery so that it does not deliver inappropriate shock. And also for the energy device that you want to use, if possible, try to use the monopolar. Okay. But if you have to use the bypass, use only bipolar. Use only bipolar if possible. Ini saya tersilap. Okay. If possible, use bipolar only. Okay. But if you still need to use monopolar, okay, so you have to use the written electrode pad, try away from the current pathway route. Okay, so that it will not interrupt, or it will not interrupt your pacemaker. Okay, intraoperatively must make sure the CPR trolley is available. Okay, must make sure there's a presence of external defibrillator equipment. The patient you must continue the patient cardiac monitor during surgery. Alternative pulse monitoring.
Hey, Simon.
Surprise.
The patient, the NS, you must have a good communication with the NS team, so that if the cardiac arrhythmia occur, so you can stop the surgery immediately. Okay, if you use the monopolar, if you use the monopolar, must make sure you use it short bursts, and also try limit it and avoid long surgery. Okay, so post-operatively, must make sure the pacemaker functioning after the surgery. Continue cardiac monitoring. You have to monitor the patient CCD. Avoid cardiac risk. Try to avoid patient electrolyte imbalance, hypoxia, anemia, and you must give patient adequate analgesia. Okay, that's all for me. Okay, thank you. Soalan tadi, jawapan tanda sendiri saya rasa dapat.
Okay, thank you, Mr. Yusuf. That was very helpful to go through the OSCE scenario. Any questions from anybody online or on offline? Well, in the room. Ada nak tanya apa-apa? I think there's no questions for you, Mr. Yusuf.
Okay, so, no question.
Tak ada question. So I thank you for spending your Saturday with us, and it was a very helpful lecture.
Okay, thank you so much.
Thank you.
Thank you, Mr. Yusuf. Enjoy your long weekend.